I want to start in some respect where the PAHO director ended on the note regarding where we are at. As she spoke, she reminded us that the HIV story has changed. Today, as we commemorate World AIDS Day, we could do the contrast between the event way back in 1997 or even in 2007. Certainly, it is not the same kind of commemoration we are having today. 10 years after 2007, we have a better story to tell. A story that persistence matters and that working together in unity, so much more can be achieved. We are here because so many entities, and many of them have been referred to by previous speakers, came together and partnered to free the world of HIV and AIDS. And we want to give a hand of applause to all these entities from PANCAB to UNAIDS, the whole list of them. Let's give them a round of applause for partnership in this effort. On this day, the Caribbean signals to the world that our region can be the first to end new HIV infections among children. This evening, 6 of our islands, including my own homeland of St. Kitts and Nevis, will join Cuba to be validated as having eliminated HIV and syphilis transmission from mothers to babies. This is a remarkable achievement which deserves commendation and applause. So congrats to all who have helped to make it happen. Congrats to UNAIDS, to PANCAP, to UNICEF, to the Clinton Foundation, to PEPFAR, to PAHO, WHO, and indeed the governments of the Caribbean, and our indefatigable health workers. Could we give them all a round of applause? I want to remember one of our regional civil servants in Dr. Edward Green. I had served in many positions at CARICOM before I now serve in the office of Prime Minister. Dr. Green had been one of those technocrats on whom we could have always relied for support, for advice, for counsel on matters of health. He has had another higher calling at the UN in terms of advocacy, but his love and commitment to this region have always remained strong. Dr. Green, could you stand and could we give him a round of applause and thank him for his contribution. There are, I am advised, an estimated 310 people living with HIV in our region. And at present, I'm told we have just under 300 persons living with HIV/AIDS in St. Kitts and Nevis. Their prospects are far different from what would have been in a bygone era when an HIV diagnosis meant certain death, or even during the period when HIV medicines were so expensive that only a few individuals had access to them. From 2000 to 2016, the number of people on treatment in our region more than doubled. In fact, we crossed a boundary in 2016 when, for the first time, more than half of all people living with HIV in the Caribbean were accessing antiretroviral therapy. We are gathered together again on World AIDS Day 2017, not with fear nor sorrow, but with the confidence that we have the tools to end this epidemic. The 2016 Political Declaration on HIV and AIDS provides a roadmap for delivering on the Sustainable Development Goal to end AIDS by 2030. We now know that diagnosing and treating people early and lowering the level of the virus in their blood to undetectable levels keeps them healthy and dramatically reduces HIV transmission. The Ministry of Health of St. Kitts and Nevis is committed to scaling up treatment to ensure that people living with HIV are able to stay healthy and alive. On August 24, 2017, the Ministry of Health, in collaboration with PAHO, hosted a mini symposium which focused on the clinical management of HIV/AIDS in an effort to help improve the health outcomes of people living with HIV in our Federation. The Ministry also recognizes that we will not achieve the global targets by scaling up treatment alone. In this regard, more energy and efforts have been placed on HIV prevention, particularly in workplace settings and among the key populations, with increasing availability and uptake of condoms, testing, and screening. These interventions were accomplished through collaboration with external partners, including civil society organizations and the NGO communities. In our region, we have agreed to adopt a fast-track strategy that involves increasing prevention, testing, and treatment services while working to eliminate the difficult stigma and discrimination. Central to this goal are the 90-90-90 treatment targets that we aim to achieve by the year 2020. These are 90% of people living with HIV knowing their status. 90% of those diagnosed are on treatment, and 90% of the people on treatment have undetectable viral loads. Our challenge is to quicken the pace while ensuring that no one is left behind. We have a small window of opportunity remaining to close several gaps. Of all people living in with HIV in the Caribbean in 2016, about 36% were unaware of their HIV status. Late diagnosis is a challenge, particularly for men, and we have heard that before. In some countries, as many as 1/3 of the diagnoses were among people whose immunity had already been seriously compromised. As Dr. Nunes mentioned earlier, we have quite a bit of ground to cover in order to increase the proportion of virally suppressed people on treatment from 67% now to the target of 90%. It is estimated that 9,400 people in our region died due to AIDS-related causes last year, while there were 18,000 new HIV infections, a level I'm advised that has remained stagnant since around 2010. Given the present circumstances relative to HIV/AIDS, the issue of a right to health is critical to the Caribbean region. We have to understand why people continue to become infected with HIV, to get diagnosed late, to achieve less than optimal treatment outcomes, or to die when prevention, testing, and treatment services are available and could prolong their lives. As a region, we must do a better job at gathering disaggregated data and producing timely and reliable analysis. The Caribbean must build capacity around developing the strategic information that will inform policies by telling us who is most at risk, where do we find them, and how we can best connect them with the services that they need to either prevent HIV or to live positively. In this regard, the National AIDS Program recently developed a comprehensive HIV reporting form or instrument to capture relevant data and strengthen HIV surveillance in the Federation of St. Kitts and Nevis. I urge my colleague heads of government to prioritize the fast-track targets. We must make it our business to know how far our countries have progressed, how much ground is left to cover, and determine the evidence-informed way forward. Securing people's right to health is, of course, not just about HIV. The issues that concern a person living with HIV are often the same as anyone else. Are my medicines available? Will I get accurate lab results? Will I see a doctor in a timely manner? As we continue to strengthen our health systems, building an integrated public health response, and ensuring universal and affordable access, we will bring our region closer to the Sustainable Development Goal of securing the health and well-being of all. The dynamic that makes HIV different from any other manageable health condition is undoubtedly stigma and discrimination. The outlook of our HIV journey has changed, but public attitudes certainly have not caught up. At this juncture, a combination of ignorance, prejudice, shame, machoism, and fear are undermining the potential impact of game-changing scientific advances. That brings us then to the theme, everybody counts. The Caribbean is familiar with fights for social justice, from the abolition of slavery to the hard-won victories of the labor movement in the 1930s, from colonialism to independence, from education for all to the ongoing strides to our gender equality. I am convinced then that we have what it takes to end stigma and discrimination in our clinics and in our communities, our hospitals and in our homes, in our reading rooms, in our educational institutions, and on our recreational grounds. We must work to ensure that no one is excluded because of who they are. This includes the young people whose rights to information and services are not being fully realized. It includes the men who get diagnosed late and the women whose vulnerabilities increase by violence or poverty. It includes our prisoners, the migrant populations, the people with disabilities, men who have sex with men, people who use drugs, sex workers, and transgender people, groups we often forget and that very often we marginalize. Importantly, it includes people already living with HIV. So on the occasion of World AIDS Day 2017, let us recommit to our obligation to respect, protect, and fulfill the right to health for everyone. We must make good on this golden opportunity to save lives and change the course of history. I thank you very much for listening.